Good morning. We're here to get an update on COVID-19 in Oregon, and I'm joined by Patrick Allen, Director of the Oregon Health Authority, Rachel Banks, Public Health Director at the Oregon Health Authority, and Dr. Dean Seidlinger, our state epidemiologist. Today, we'll share the next steps in our vaccine rollout, but first, I'd like to take a moment to acknowledge the great progress we've made in battling COVID-19. This Sunday marks 1 year since the first case of COVID-19 was reported in Oregon. I remember that day as if it were yesterday, and at the same time, it feels as if it's been much longer than 1 year. For the past 3 weeks, we've seen our case counts steadily decline. Our hospitalizations have matched that. And last week, we reported the lowest COVID-19 deaths since the summer. Oregon's percentage of positive tests has consistently hovered around the 3% mark, which is also a promising sign. It means the smart choices Oregonians continue to make are helping slow the spread in our communities. Over the past year, the entire world has faced new challenges with the pandemic. I've been inspired and impressed by the sense of community and responsibility that Oregonians have shared to protect one another during these tough times. I've said it before, but it deserves being said again. Oregon is a really special place, and I'm so touched by how strong, resilient, and brave you all have been through these unprecedented circumstances. Thank you. 1 year in, with our vaccine efforts continuing to ramp up, we truly see the light at the end of the tunnel. Like every state, we've had some bumps along the way, but overall, we're getting shots into the arms of Oregonians quickly, safely, and equitably. We have more than 14% of Oregonians vaccinated with their first dose, which is more than 500,000 Oregonians. And at least 1 in 3 seniors age 65 or older have had at least 1 dose of the vaccine. Today, we're sharing who's up next to receive the vaccine and how we'll be ramping up our efforts as more supplies come online from the federal government. For the next month, we will continue our focus on vaccinating seniors. Then, beginning on March 29th, we'll open up to the next group in 1B. This group includes adults ages 45 years to 64 years with 1 or more CDC-defined underlying health conditions. A portion of our frontline workers who are highly vulnerable as we enter busy seasons for them, including our migrant seasonal farm workers, seafood, agricultural, and food processing workers, and our woodland firefighters. It also includes families still displaced by the September 2020 wildfires, people living in low-income and congregate senior housing, and individuals experiencing homelessness. The next phase, starting no later than May 1st, includes the rest of our frontline workers as defined by the CDC. This group is very broad, but the parameters are also very clearly defined. The CDC defines this group as necessary for the functioning of society. These are Oregonians that have a job that puts them at higher risk for contracting COVID-19 because they either cannot work from home or find themselves in regular close contact with people outside their household while at work. This includes people like our grocery store employees, members of the media, public transit workers, and the U.S. Postal Service. There are many more that fall into this category, and Director Allen can share more details. Also, starting no later than May 1st, will be adults age 16 to 45 with 1 or more CDC-defined underlying health conditions. And from there, we will open it up to the general public. No later than June 1st, will be general population age 45 years and older, and no later than July 1st, all Oregonians age 16 and over will be eligible for the vaccine. Yes, you're hearing me correctly. Come summer, provided supplies from the federal government continue as planned, any Oregonian who wants the vaccine will be eligible to receive it. And while that gives us all a reason to breathe a sigh of relief, it should also serve as a reminder that the finish line is in sight and we cannot let up. New variants of this virus still threaten our communities. While infection rates continue to plummet both here in Oregon and across the country, we're not out of the woods just yet. We must continue to make smart choices around the safety measures we know work. Keeping your masks, physical distancing, and limiting social gatherings. I also this morning would like to thank the Vaccine Advisory Committee for the work they did to help center equity through this process. Prioritizing adults with underlying health conditions helps reach some of our most vulnerable members of the Black, Indigenous, and people of color communities, because these folks are most at risk of contracting severe COVID-19 because of conditions such as sickle cell disease and diabetes. Before I turn it over to Director Allen, I also wanted to share the state is working with FEMA to support our vaccination efforts. Not only will FEMA be providing $220 million to reimburse our hospitals, clinics, and local public health entities who have helped step up to vaccinate Oregonians, but we also have their people power to support the Tri-County area's high-capacity sites. This includes the Oregon Convention Center and the drive-thrus at the Portland Airport and the Hillsborough Stadium. FEMA will also be working with vaccine sites at Deschutes and the Salem Fairgrounds as well. Initially, 20 staff will arrive next week to plug into our operations. FEMA representatives will continue their assessment of staffing needs to help us develop solutions that will provide immediate relief to our hospital staff, while also focusing on long-term sustainability. We are really grateful for this assistance and look forward to the next steps in our vaccine response. Each week, more supply comes online, more Oregonians get vaccinated, more progress with each and every day. And with that, I'm going to turn it over to Director Allen.
Thank you, Governor Brown. Again, I'm Patrick Allen, Director of the Oregon Health Authority, and I'm joined today by Rachel Banks, our Public Health Director. This morning, I want to give you an update on Oregon's COVID-19 immunization effort and tell you why we're speeding up the timelines we've set for opening eligibility to the next groups of Oregonians. Director Banks will tell you how we've prioritized those groups in alignment with the Centers for Disease Control and Prevention's recommendations, and where we've made decisions that address the specific needs of people in Oregon. As Governor Brown announced, today marks a major turning point in Oregon's vaccination program and our state's ongoing fight against the coronavirus. We're staying true to our commitments to seniors. We will open vaccine eligibility to people 65 and older on Monday, March 1st. We expect to have been allocated enough vaccines to immunize at least 75% of all seniors by March 29th, weeks ahead of our original timelines. We're speeding up our timelines, not backing off. For the first time since the pandemic started, we can provide a timeline that will tell every adult Oregonian a date before which he or she will be eligible to get vaccinated. The first members of the general public will be eligible for the COVID vaccine, as you heard the governor say, no later than June 1st. This will bring into clearer view a time when we will be freed from the grip of the pandemic and we can see our loved ones, celebrate holidays, and return to more of our normal life again. But as we get there, we all will have continued work to do, wearing masks, limiting indoor gatherings, and keeping our distance. The federal government and vaccine manufacturers have committed to sending game-changing volumes of vaccines to states. We intend to ramp up vaccine distribution in Oregon to vaccinate as many people as possible, as quickly as possible, and stay ahead of the dangerous and rapidly mutating novel coronavirus. But as always, our ability to meet these timelines depends on the same factors we've balanced all along: an adequate and consistent supply of doses from the federal government, the number of people eligible and willing to get vaccinated, and the capacity of our vaccination sites to immunize people. But first, let's start with a look at where we currently stand. As of yesterday, February 25th, Oregon vaccinators have administered 911,648 first and second doses. Over the past week, Oregon vaccinators administered an average of 20,027 doses per day. Over 500,000 Oregonians have received at least their first dose. Oregon has administered first doses to 14% of our population, which is also the national average. Oregon has administered full two-dose vaccinations to 317,702 people. Overall, 7.2% of Oregonians have been fully vaccinated, and there we're ahead of the national average, which is 6.5%. At this stage in our rollout among older adults, approximately 156,000 Oregonians aged 70 and above have received at least one vaccination. That's 31% of all currently eligible seniors. About 46% of people 80 or older have been vaccinated. In all, 194,565 people aged 65 or older have had at least one dose of the COVID-19 vaccine. That's more than 1 in 3 total seniors. Now let's look at the timelines and the eligible populations Governor Brown announced. And let's go to the first slide, please. As we'll show in a moment, we expect to have been allocated enough doses to have vaccinated nearly all eligible populations by the end of March. We know our eligible population numbers have always been based on estimates. We need to work harder to reach some people who can't easily get to a vaccination site, and unfortunately for all of us, some ineligible people have been vaccinated. That's made our task and timelines more complicated. But good news, as this chart shows, we intend to open vaccinations to the following Oregonians no later than March 29th. Adults age 45 to 64 with one or more CDC-defined underlying health condition with increased risk, food and agricultural workers, people living in low-income senior housing, senior congregate, and independent living, people experiencing houselessness who are sheltered or unsheltered, wildland firefighters, and currently displaced wildfire victims. No later than May 1st, the following Oregonians will become eligible: adults 16 to 44 with one or more CDC-defined underlying health conditions with increased risk, frontline workers as defined by the CDC, including state and local frontline employees, people who live in multi-generational households. And then we expect to open vaccines to the general population starting in June, no later than June 1st for Oregonians age 45 to 64, and no later than July 1st for all Oregonians over age 16. Director Banks will tell you more about how these populations were prioritized in light of the recommendations of the Vaccine Advisory Committee and in line with CDC guidance, and where and why we departed from the federal recommendations in specific cases responsive to Oregon. But first, let me show you our math that gives us confidence we can meet these timetables. Let's go to the second slide, please. As you can see from this slide, the amount of vaccines we've received is still far less than the number of people who are eligible. Oregon has already received more than 1 million cumulative doses, but that's far short of the 1.3 million people currently eligible to get vaccinated. And so for the next week or two, we'll still face shortages. For the next week or two, appointments will be hard to get, and for the next week or two, many seniors still won't get a vaccine right away, and many people will be frustrated and unhappy. But the landscape changes dramatically for the better in mid-March. Our allocations climb quickly. This week, Oregon received 111,000 first doses. Next week, we expect to receive 120,000 first doses. Over the following 14 weeks, we project Oregon would receive 120,000 doses at a minimum, and as much as 190,000 to 205,000 first doses per week if promised supply surges materialize. Those numbers are based on information we've received from the federal government and testimony by Pfizer, Moderna, and Johnson & Johnson in Congress in recent days. Based on our current expected allocations, by late March, the cumulative number of first doses we receive will exceed the number of older adults, healthcare workers, educators, and other people who are currently eligible. Based on current projections of federal supplies, we should receive 1.4 million cumulative doses the week of March 21st, more than the 1.3 million currently eligible, before we add new eligible populations. Now, I want to caveat these projections by saying, as always, these projections depend on vaccines actually materializing in Oregon from manufacturers and the federal government. By late March, we know some seniors and other eligible people still may not have been immunized. We know there are some people who've been vaccinated who weren't eligible. They've crowded out seniors and other vulnerable people. It's not fair or right, but we know it's happened. So let's turn to March 29th and beyond. How will we manage to meet the timelines to vaccinate everyone else, starting with vulnerable people with underlying health conditions? Now let's go to the third slide, please. This slide shows how our projected doses compare to the number of adult Oregonians if vaccine makers delivered the contracted supplies they told Congress they intended to begin to deliver to states starting in March. If Oregon's prime dose allocation increases to approximately 200,000 doses per week, Oregon would have enough first doses to vaccinate 7 in 10 adults by the end of April 2021, and all adults by the end of May 2021. Again, these projections depend entirely on our supply. The good news is that not only can we achieve the timelines the governor announced, we may be able to move them forward. But until we see these doses show up in the ordering system, we're going to continue to take a conservative approach. But what about capacity? Can Oregon's vaccination sites handle a doubling of vaccines? Let's go to the fourth slide, please. Recently, we surveyed our current vaccine providers to ask if they could handle more vaccines. Their answer, yes. As this slide shows, Oregon's vaccine sites can administer more than 3 times the amount of doses they're currently administering if they have more supply. In addition, as more vaccines become available, we can expand vaccine distribution points to more locations where many people are used to getting vaccinated, such as more retail pharmacy outlets, outpatient clinics, and other sites linked to hospitals and health systems. These sites will help loosen the bottlenecks people are currently experiencing as the crushing wave of demand swamps the limited sites we have available to offer restricted supplies of vaccine. Before the end of March, we'll not only see dramatic expansions in supply, but in the types of places where people can go to get vaccinated. Finally, I know scheduling an appointment at the Oregon Convention Center has been hard for many seniors and their families. We recognize the demand for doses is overwhelming our partners' scheduling systems. Next week, we're going to try something new. We're going to use the registrations from the Get Vaccinated Oregon tool, which can be found on covidvaccine.oregon.gov, as an invitation system. If you register in Get Vaccinated Oregon, we will transfer the names of eligible people in the metro area out of that system and send them to partners at the convention center. They'll contact you to schedule an appointment, so you don't have to wait for 3 hours clicking in hopes of getting one. We really appreciate everyone's patience and hope this change will make the experience better. Now let me turn it over to our Public Health Director, Rachel Banks, to talk about how we prioritize the next groups of eligible Oregonians.
Thank you, Director Allen and Governor Brown. As we approach prioritizing the remaining groups of Oregonians, we wanted to stay true to the intent and the recommendations of the Vaccine Advisory Committee and remain consistent with recommendations from the Centers for Disease Control. This balance ensured that our priorities took into account Oregon's commitment to equity, Oregon Health Authority's goal to end health inequities by 2030, and the unique frontline worker roles that are core to our communities and that have kept us functioning during the pandemic. And we wanted to uplift the scientific and medical consensus at the national level. Alongside the Vaccine Advisory Committee, we looked at who's at an increased risk of contracting COVID-19 and becoming severely ill. Where have we seen the most frequent and prolific outbreaks? Where can we address the worst disparities and inequities that this pandemic has exposed and intensified? The Vaccine Advisory Committee sent a strong statement along with their recommendations of who should be eligible next. Their statement says the Vaccine Advisory Committee acknowledges structural racism and pressure from systems that are not ready to center this truth about the ways that structural racism impacts the health of Black, Indigenous, and people of color communities. Vaccine Advisory Committee sequencing was in consideration and in review of the data and needs of Black, Indigenous, people of color communities, and refugee communities. Vaccine distribution must include working with trusted community partners, including community-based organizations, faith leaders, and trusted entities where people feel comfortable. An organ health authority must track and use data along the way to capture information about medical mistrust and barriers. I want to sincerely thank the Vaccine Advisory Committee for their time, for their diligence, and ultimately for their recommendations, which you have seen today. So if we can go to slide 5, please. Let's start with people who will become eligible no later than March 29th. Oregon is using the Centers for Disease Control's definition of underlying health conditions with increased risk. We estimate that about 800,000 Oregonians have a CDC-defined underlying health condition, but many people in that group may have multiple underlying health conditions, and they may have also been included in other eligibility categories. They may have also been previously vaccinated. Adults aged 45 to 64 who were not included in previous groups will become eligible starting no later than March 29th, and if they have one or more of the following conditions: cancer, chronic kidney disease, chronic obstructive pulmonary disease, or COPD, Down syndrome, heart conditions such as heart failure, coronary artery disease, or cardiomyopathies. Also immunocompromised state, like a weakened immune system from solid organ transplant or HIV. Obesity, defined as a body mass index of 30 or more. And a body mass index is a person's weight in kilograms divided by the square of height in meters. BMI is an inexpensive and easy screening method for weight categorization, and the Centers for Disease Control considers a BMI of 30 or above as obese. It will also include pregnancy, sickle cell disease, and type 2 diabetes. In addition, we'll prioritize people whose work puts them at a greater risk based on prior outbreaks, people living in congregate settings, or people whose seasonal exposure requires timely immunization. Those groups include food and agricultural workers, including migrant and seasonal farm workers, seafood and agricultural workers, and food processing workers, people living in low-income senior housing, senior congregate and independent living housing, people experiencing houselessness who are either sheltered and unsheltered, people who've been tragically displaced by wildfires, many of whom are living double up with family and friends or in other temporary quarters, and wildland firefighters who will be deployed to fight fires and living in group camps soon. No later than May 1st, we'll move to frontline workers and other groups. Once again, Oregon is following federal Centers for Disease Control recommendations in defining frontline workers. This slide lists workers in sectors who will be eligible to get vaccinated. However, there's a 3-part test to determine if someone who works in these sectors is a frontline worker. Does a worker have regular close contact, less than 6 feet, with people who live outside of their household? Do they have routine, prolonged close contact with others for more than 15 minutes? And do they have to work in close contact with people to the extent that they can't work from home or another setting where they can practice social distancing? Workers who meet those criteria in these occupational fields and industries will be eligible to get a vaccine no later than May 1st. If you work in one of these fields but you don't meet those criteria, you'll have to wait unless you qualify under a different group. Frontline workers have been working, keeping our communities going, working day in and day out in the face of a deadly virus, and we thank you. We are so grateful for your service. Also, no later than May 1st, we will also be opening up eligibility to members of multi-generational households. This was a strong recommendation from the Vaccine Advisory Committee. We know that people who live in multi-generational households include people from communities of color and tribal nations who have borne a disproportionate burden of COVID-19. A multi-generational home can be rich in family connections, and we also know that the interaction and sharing that happens in a close-knit home can put people at risk for COVID-19, especially older people. This recommendation will help us address the current inequities in our vaccination rates and inequities in our infection rates. We will also open vaccination eligibility to people between 16 and 44 with underlying health conditions no later than May 1st. While younger people living with underlying health conditions may not face the same risk as older people, they're still at a greater risk than the general public. In total, we estimate the number of people who become eligible by May 1st is approximately 980,000 people. We will make vaccinations available to the general public no later than June 1st for people who are between the ages of 45 and 64, and no later than July 1st for people between the ages of 16 and 44. Going forward, as more vials of vaccines are shipped to the state, our ability to achieve a level of protective vaccinated immunity will depend on another factor: the percentage of Oregonians who choose to get fully vaccinated. As Director Allen said, we can see a point in time by late this summer where every Oregon adult will not only have had the chance to get their first vaccination, but their booster dose too. That possibility offers great hope, and it poses an additional challenge. Soon, we'll reach a point where we no longer have too few doses for too many people who want them. We'll have enough doses for everyone, but the question will be, will enough people take them? It's been a really hard year, and we've made great progress, but the pandemic isn't over yet. And the COVID-19 vaccine is the safest and most effective way to protect yourself and your loved ones and return to more of our normal life. But we need a critical mass of Oregonians to take it so more people are protected. And newly emerging variants add urgency for all of us. We know many people have questions. We know the experience of racism and memories of historical trauma and medical experimentation are alive in many of our communities. Others are wary of government. We are working hard to get information out broadly and for specific communities to increase vaccine confidence. I hope every Oregonian will make an informed decision. And as your public health director, I know vaccines are a vital tool to protect the health of the public. I look forward to the time where every Oregonian is eligible for the vaccine and when they choose to get vaccinated so we can prevent unnecessary sickness and deaths from COVID-19. Thank you, Oregonians. Thank you for your diligence wearing masks, maintaining physical distancing, and getting vaccinated when it's your turn. Now I'll turn it back over to Governor Brown.
Thank you, Director Banks. Director Allen, we really appreciate your leadership. And with that, Charles, we're ready to take questions.
Thank you, Governor. We'll get started with John Hendricks from KPTV. Go ahead, John.
Thank you for taking the time to chat with us again today. We were wondering about the different counties and getting vaccinated. Can you go to a different county to get a vaccine? We've had viewers reach out saying that they have had their appointment canceled because they don't live or work in a neighboring county. I guess what's the guidance on that?
Thank you, John. I'm going to turn that over to Director Allen.
Yeah, thanks. The answer is generally yes, but not always. We've got sites like the Salem Convention Center that we really think of as a statewide resource for people to be able to get vaccinated. The pharmacy program is open to people regardless of where they're from. We are trying, however, to do some targeting of doses to specific clinics and specific areas that have been especially hard hit, and we would consider those what they call a closed point of distribution. Where it's restricted to a particular population. You'll see the same thing happen when we move to frontline workers, where there'll be pods, they call them closed pods, that have to do with employees at particular companies or those sorts of things. So like everything else about COVID, the answer is a little bit complicated, but basically if you receive a legitimate invitation to schedule an appointment, then you should feel comfortable in being able to schedule that appointment. I think what we have seen are people sharing links with folks who weren't included in invitations and some of those kinds of things. And those appointments have been canceled inappropriately so.
And then John, just to clarify, it's the Salem Fairgrounds, not the Convention Center.
Oh, sorry, yes.
And then another question that we had, what was learned during the rollout for seniors that played any role in planning for this next group of people? I know that there was that pinch point with getting appointments. Was this timeline stretched out because of what we saw with seniors?
Well, I think the biggest thing that we've learned from seniors, we got through the first 2 weeks with a lot of traffic jam, but this last week was just really, really extreme. And so that's why we've moved to an invitation system. How we move going forward, I think is going to depend on exactly how much vaccine there is. If we have enough that we can pretty much have it everywhere, we'll probably not need to use an invitation system in that same kind of fashion. But we'll be able to assess that when we get closer to March 29th.
And John, we really appreciate the strong partnership that we have with our community partners, including public health, our federal pharmacy program, and our federally qualified health centers. They've been doing a really good job reaching out to seniors that don't have access to the internet. In Multnomah County, there's a great partnership with REACH to hold a BIPOC vaccination clinic. They had 400 people come through that this week. And at Yellowhawk Tribal Health Center, they had a mass vaccination clinic for Umatilla Indian Reservation residents February 23rd to 24th. So we've got a lot of really strong partners on the ground in communities around the state to help us reach these seniors that we need to get vaccinated.
Thank you, John. We'll go next to Sarah Klein with the AP. Go ahead, Sarah.
Hi, yes, Governor, you kind of just mentioned this, but I'm curious what the state is doing to help get a shot to seniors who might be disconnected, socially isolated, or without resources such as family members to, help them sign up.
Thanks, Sarah. I just went through some of those, and so I'm going to turn it over to Director Banks to have her detail some more situations.
Thank you for the question. So some of the things that we're doing is working with federally qualified health centers, local public health authorities, and we funded a network of over 170 community-based organizations. They include organizations that are serving seniors specifically, and then also other organizations, faith-based organizations, for example, that serve a wide variety of people, including seniors. We have counties and a variety of different examples in counties. Some include the Interfaith Network in Marion County, as well as the Rosewood Initiative, as Governor Brown mentioned, the REACH initiative that's working with Highland, Haven, and as well as Asian Health and Service Centers, who are working with elders and seniors in their population to help them get signed up or to help give them information that they would need. So those are some of the examples that we've seen thus far to work with and reach out to seniors, as well as we're working with AARP to do a mass mailing. And we continue to have options that are available by phone as well as online.
And just a quick follow-up to that, have you guys had many anecdotes or heard of many cases of seniors slipping through the cracks?
Thank you. Director Banks, do you want to respond to that, please?
Sure. I mean, we're particularly interested and aware that there may be those folks who fall in between the cracks, and we're particularly focused on those who often get left behind, those for a variety of reasons. They're homebound or they are from communities of color, and that's why we funded community-based organizations and are working with local public health authorities to come up with creative solutions, including providing transportation or other options for those who are not able to access our sites. Unfortunately, at this point, we know that there are people who still want to be vaccinated who are not able to be vaccinated, which is why, as Director Allen mentioned, we're trying additional methodologies to get folks in and to have more appointments available for folks.
And Sarah, it's certainly going to look different in different communities around the state. I know, for example, in Douglas County as well, the director of local public health there, Dr. Bob Dannenhofer, they're working with providers. And so seniors in Douglas County can contact their physician or their nurse to secure an appointment. So it really looks different in communities around the state. We could not be doing this without our incredibly strong partnerships with local public health, with our hospital and health systems, with our federally qualified health centers, and frankly, just wonderful community-based organizations that are not only working with us to get the word out, but literally helping us get seniors to the right place, or in some circumstances, getting a mobile van to where the seniors are.
Thank you, Sarah. We'll go next to Genevieve Riome with K2. Go ahead, Genevieve.
Hi, Governor Brown. Thanks for taking these questions today. And Pat Allen and Rachel, thanks. We appreciate your time. A few questions related to schools. The first one is there an update on the percentage of states students that are currently back in the classroom? I know last week it was 20%.
Thank you. Yes, I had an opportunity this week to tour Calapooya Elementary School. It's part of the Salem-Keizer School District. The elementary school is located in West Salem. Had an opportunity to talk to a first grade teacher and the principal there. I will tell you that the students that they are talking to, and they've got some limited in-person instruction happening, the students are bouncing off the walls with excitement to come back to the classroom. In talking to the first grade teacher, Ms. Ames, she is also very excited, and obviously the principal is as well. So they're looking forward to welcoming more students to in-person instruction over the next week or so. At this point in time, we have 138,000, roughly 20% of all students participating in in-person instruction. We have over 635 schools with hybrid or more, and we have schools with limited in-person instruction or full instruction over 1,100.
And we know several large school districts won't start hybrid learning until teachers have access to both shots, but the CDC says vaccine access should not be a condition for reopening schools. Nearly a year ago, you ordered schools to close. Why aren't you mandating they reopen?
That's a really good question. I am working with communities around the state, with superintendents and with educators to make sure they feel comfortable with safety plans that they have in place. Right now, we have provided every single tool that I have, including, as you mentioned, vaccinations, testing capacity, resources. Congress provided additional resources to the schools. And under the leadership of Colt Gill at the Department of Education, Oregon has one of the most rigorous protocols for safe in-school learning, our Ready Schools Safe Learners Protocol. So we are working with districts to get more and more students back into the classroom. And I really appreciate the strong leadership of superintendents across the state in our districts, urban and rural, and everything in between. Director Allen, would you like to jump in?
Sure. I think the Ready Schools Safe Learners guidance was developed with an eye toward how to reopen schools in the absence of vaccines. And so the fact that vaccines are now available and moving forward, I think adds to that level of safety. And we're seeing schools successfully open around the state. I think this becomes even easier as infection rates drop in many communities, because schools really are reflective of the amount of COVID that is in a community, and as it drops, the risk continues to go down as well. So we think we've really set the table for schools to be able to successfully reopen.
And Governor Brown,
Genevieve, if you have just one more follow-up, Genevieve, we've got a number of your colleagues as well.
One quick follow-up. Thank you, Charles. Governor Brown, you mentioned that you're using every tool in your toolbox, but you could use an executive order to mandate that schools start again. Why won't you do that?
Well, I appreciate the question. It's my expectation that for school districts around the state that meet the metrics, that we begin in-person instruction for elementary students. And I fully expect school districts around the state to continue move forward and provide in-classroom instruction. We know that our students do better with in-person instruction, and we know that students across the state, many of them are struggling with comprehensive distance learning. We talked earlier about the level of anxiety and depression, the challenges. We know a lot of kids thrive by getting 2 meals that they see in the classroom and being surrounded by a safe adult and a classroom where they can safely learn. So I'm doing everything I can to get our students back into the classroom. And it's my expectation as districts meet the guidelines that our children return safely to the classrooms.
Thank you.
Thank you, Genevieve. We'll go next to Lisa Balick with COIN. Go ahead, Lisa.
Good morning. Governor Director Allen, with opening up the eligibility for 65 to 69-year-olds on Monday, why keep merging people onto the freeway that's at a standstill, especially when you tell us today that less than half of those age 80 have been vaccinated? Why not instead make a push to take care of them?
So I think, Lisa, the challenge is that for many communities around the state, they've been able to get their seniors that are eligible now vaccinated. And we believe with the additional vaccines coming online, we feel comfortable that we can get the remaining senior population vaccinated at a level of roughly 75% by the end of March. Director Allen, do you want to provide more detail?
Yeah, I think I would just say that what we've seen in the system is, especially in the Portland area, not so much a challenge with vaccine appointments because we're filling up every appointment with every dose that's available. It's the scheduling function that is the biggest challenge, and so that's why we're making the switch to a by invitation scheduling function, so people don't have to feel like they're trying to win the lottery to get onto a website and get scheduled. We think that'll help a lot. And as the governor observes, we've got communities all around the rest of the state where that scheduling problem just isn't the barrier that it is in the metro area and a couple of other places. And so, if you go back to mid-March when the previous administration told us, good news, there's a bunch of doses coming, and so you should make your seniors all eligible. You should make your people with pre-existing conditions eligible. And we kind of took the bait and said that we were going to schedule seniors, and then 2 days later had to tell them, sorry, you're not actually going to be able to start getting vaccinated next week. It was important, I think, to provide them some dates, some time frames that they would become eligible and be able to schedule. And while we've got this scheduling challenge that we're working to fix, it just seems really difficult to go back yet again to those same seniors and say, and it turns out that date's not going to work either, and we'll get back to you. So I think by changing the scheduling system to invitation, we'll clear out the logjam, and then the increasing supplies will help us get through that population much quicker.
So will those 80 plus be prioritized in that system?
No, we'll continue making everyone who's eligible eligible. If we prioritize, we're effectively making people who are younger no longer eligible, and we're not going to do that. So we'll provide appointments to everybody who is in the 4 eligible bands.
Thank you, Lisa. Our next question is from Gary Warner with EO Media. Go ahead, Gary.
Good morning, Governor and Dr. Allen. From the letter that the Republicans who walked out yesterday, that one of the issues that they raised was confusion and anger over what exactly is going on with vaccination supplies in the East and central areas and the southern areas. I think that Director Allen and I have kind of touched on this, in that at one point you were taking supplies back when a county was done with the current authorized phase level. Is that going to continue to happen, or is it by broadening out these categories that's not going to be an issue anymore? So if a county gets ahead of your dates, are they going to stop seeing vaccines coming in? The other big thing is, you've said all along that you're not keeping track of refusals. That doesn't seem like a very good idea. At some point, you're going to have to know who hasn't taken the vaccine and go swing back around on that. Are you starting to monitor that at this point?
Thanks, Gary. All I will say about what happened yesterday is that Oregon is facing a slew of unprecedented crises, from the winter storm we had, President's Day weekend, to the historic wildfires that we had over Labor Day 2020, to this pandemic, to a long overdue clarion call for racial justice. Just yesterday, I ended up meeting with elected officials from Douglas County, from Jackson County, and Lincoln County to talk about wildfire recovery efforts. And all I will say is this: I expect elected officials, regardless of their party affiliation, to show up and do their work. Director Allen.
Yeah, so a couple of things. First, just to be clear, if you go to our dashboard where we track the geography of what percentage of the population has been vaccinated, you would see that the upper quarter of counties include Hood River, Sherman, Wheeler County, Jefferson County, Deschutes County, Wallowa County. So I think I think we're doing a good job of making sure the vaccine is distributed not just to urban areas but around the state. I think as we get toward the end of March, like we did as we closed in on making seniors eligible, we'll need to see where things are in terms of how much vaccine has been distributed and where the population is getting vaccinated. You talked about it may not be a good idea not to track refusal rates. I think it's important to note it's not that we could be doing it and we're choosing not to. It's that it's extraordinarily difficult. There aren't really good ways to track who's deciding not to get a vaccine. Over time, we can see what that looks like as people do or don't get vaccinated. And if we get toward the end of the month and we start seeing that people in Malheur County are getting vaccinated at a super high rate and people in Washington County aren't, we may make some changes to how we allocate vaccines to respond to that.
Final question, Pat, is the one I always have is, when will we be done with everybody? What's your projection for when everybody not only will be eligible, but could conceivably be vaccinated?
Yeah, so I think it's funny, I haven't actually calculated the end date versus the start date, but given that we think we can get through the first part of the general population in about a month, I guess I would say that we could be looking at August or September as a point where everyone's at least got a first dose, and then I think it's a little bit time beyond that for second doses.
Thank you.
And again,
that's good news.
Gary, that depends on federal supply and allocation. The good news is, while we don't have enough vaccines right now for everyone that wants them, the good news is the allocations from the Biden-Harris administration continue to increase. So that's really good news. Charles, back to you.
Thank you, Governor. Thank you, Gary. We'll go next to Pat Duras with KGW. Go ahead, Pat.
Thank you. So two-part question, if you don't mind. The first is on these names that will be sent to the scheduling site here in Portland. Just following up on Lisa's question, how will you decide which names are sent first? If there's only 5,000 or 7,000 doses available, will it be alphabetical or random, or is it first come, first serve? And then secondly, I know things are going well for many parts of the state, but in Portland, as you've said, it's clearly not. There were 400,000 attempts to schedule appointments yesterday. So why not call for a 2-week pause just for the Portland area to allow the vaccine to catch up and to allow our most vulnerable seniors, which is what this was designed for, allow them to get protected? Thank you.
Thank you, Pat. I think the short answer to your question is we want to keep our commitments to seniors, and we're going to do that. I know it was really difficult this week. Our partners had technology issues, and the Oregon Health Authority has developed a new system that we hope will smooth out those very bumpy edges. Director Allen, do you want to talk about the selection process and the process moving forward?
Yeah, we'll forward names selected at random. And we'll continue to forward names as we go forward based on more supply and more appointments being available. And Pat, I guess I think this by invitation scheduling change, I think will resolve the challenge that people were having, which was too many people trying to get too few appointments. The number of appointments will increase over the course of the month, and so we'll be able to make good our commitment to get people vaccinated. And we're going to have enough supply if things materialize the way it looks like they're going to take care of that population before we move on.
Thank you, Pat. We'll go next to Amy Green with the Oregonian. Go ahead, Amy.
Hi, I have two questions, but just wanted to be sure I understand first. Director Banks, can you tell me, are people with a BMI of 30 or higher, so just obese, are they considered to have an underlying condition and they'll begin vaccinations March 29th?
Director Banks, you want to take that one?
Happy to. Thanks for the question, Amy. So that is correct. So those with a BMI of 30 or above will be eligible as defined by the CDC for the obesity category.
Okay, so not just severe obesity, but anybody who's obese will be able to begin March 29th.
Correct. Obese with a BMI of 30 or above.
Okay. That makes me think that the calculation is off on saying that there's 800,000 people with underlying conditions. Oregon's about 29% of people who have obesity, and I think that calculates out to about 1.2 million adults. Do you have a better figure on how many people are in that category of underlying conditions?
Director Banks, Director Allen.
Sure. I mean, what I'll say to that is the obesity category is highly overlapped with a variety of other categories, including underlying health conditions, clearly folks, those that are in the education field, those are in the healthcare workforce, those are in a variety of other categories. I do think there are challenges in being specific and precise with the underlying health conditions category because the way that we collect data, there are all sorts of overlaps, but we think that that's our best estimate at this time, and then taking into consideration that other categories will be including underlying health conditions, including obesity.
Okay. And my second question, I'm hoping the governor can answer this because she's the one who ultimately makes the decision on vaccination eligibility. Can you explain the thought process? One, yesterday, I think the idea was it was just going to be people with severe obesity who were eligible March 29th, but it's been lowered to people with obesity. So can you explain the thought process behind that? Was it because indeed you decided to go with the CDC recommendation that people with obesity have underlying conditions and are at higher risk and should be vaccinated early? The second part of that question, can you also elaborate on why not include people who smoke? The CDC also says they have underlying conditions that put them at high risk of death or hospitalization, and that they should be included in early vaccination. So why not include smokers? Too controversial? Do it.
Director Allen, do you want to take that one?
Let me take the obesity part of that if I could, because it's basically our fault. If you look at the CDC materials on underlying conditions, they can be a little bit confusing. They bounce back and forth between guidance and then advice for people. And the CDC was using 3 categories of overweight, obese, and severely obese. And in developing the recommendations for the governor, we basically confused the 3 categories, and we were intending to exclude overweight, and that basically in editing got caught up as excluding obese. We had intended to do both, and so there wasn't a substantive decision-making change. It was our error in how we were describing that.
And I mean, in terms of the smoking versus not, we made a decision to include smoking connected illness as per the CDC guidelines, as opposed to specifically calling out smokers. Different states have done different things. In general, I will say that I relied heavily on the vaccine advisory as well as CDC guidelines in making these decisions, and really appreciate the work of the Vaccine Advisory Committee to center equity in this work. We also, of course, put our own Oregon lens on that. 2 specific examples are migrant and seasonal farm workers These folks, harvest is just right around the corner, and we want to make sure that these hardworking community members have access to vaccinations. Another decision that I made, frankly, was including wildland firefighters. They are already starting to prepare for next year's fire season. Given the amount of snow and rain that we've had in the last few days, I'm certainly hoping that we will have a milder wildfire season this year, but regardless, they still have to train, and they are instrumental to firefighting efforts in states around the entire country. So we need them to be vaccinated and protected so they can protect us this year.
Governor, I couldn't hear your complete answer to the smoker's question because there's some background noise. Do you not believe that smokers should be included just because they're smokers? It's controversial. Do you feel like it's a choice? Can you?
We just made a decision. We just made a decision to stick to smoking-related illnesses. I know different states have taken different approaches. That's the decision we made here in Oregon.
Thank you,
Thank you.
Jaime. We have time for just 2 more questions. So we're going to go quick to Ben Botkin with the Lund Report. Go ahead, Ben.
Yes, I was hoping you could give us an update on just where things are at with efforts to vaccinate seniors and others in adult foster homes. I know that's been a challenge. Thank you.
Thank you, Ben. Director Banks, do you want to pick up the question about vaccinations for seniors in adult foster care homes? I know that local public health has been a really important partner here. And I know, for example, in Multnomah County, they've had really proactive efforts to reach out to these seniors, including having a mobile van visit these homes directly. Director Banks?
Yeah, thank you for that, Governor Brown. And I would echo, we've been working with local public health authorities and having them basically attest and tell us how they've reached their adult foster homes and other populations, including adults with intellectual and developmental disabilities and other folks. We've also been working with, through our state, Oregon Department of Human Services partners to make sure that counties have lists and correct information for who their adult foster home communities are, so that they can reach out and follow up with a variety of different mechanisms for vaccination.
We have some numbers on that too that we reported to the legislature earlier this week. I don't remember them off the top, but we can get those for you.
Thank you, Ben. We have time for just 1 more question, so we'll go next to Grace Smith with KOBI. Go ahead, Grace.
Hi, good morning. Thank you. This is a little bit of a pivot away from the vaccination discussion, but I know long-term living facilities report COVID cases to the state. I'm just curious what requirements they have to inform residents. I know employers are required to tell employees about COVID cases in the workplace, and I'm just curious if there are similar guidelines for facilities and their residents.
Director Allen, can you respond to that question?
Yeah, I'm not expert on the requirements because they're governed by the Oregon Department of Human Services, but my understanding is they do have a reporting requirement to either residents or guardians of residents if that's the circumstance.
Grace,
Okay,
if you would reach out to my communications team, we can get you more detailed information on that.
Absolutely. Thank you, Governor.
Thank you. Thanks, everyone. Please stay safe out there.